Let's talk about DVT, which is also called as deep vein thrombosis. So the outline, what we are going to study today in DVT is, first we'll talk about the definition, the risk factors, the pathology, clinical features or the signs and symptoms, the criteria which is used for DVT, clinical tests also called as the special tests like the Homans sign or the Moses test, complications of DVT, medical management for DVT, the prophylactic measures, investigations, and then finally the precautions for DVT. Deep vein thrombosis. Deep vein thrombosis or DVT is a blood clot that forms within the deep veins. It mostly affects the lower limbs or the lower extremity, that is, the veins of the calf muscles like the peroneal veins and the posterior tibial veins, and the veins of the gastrocnemius and the soleus muscles. It is a complication seen after the fracture of the spine, pelvis, femur or the tibia. Now let's move forward. Risk factors of DVT. In case of prolonged period of immobilization, for example in bedridden patients, drugs like contraceptive pills, injuries to the veins during a trauma, surgery or during insertion of venous catheters, anticoagulation deficiency, smoking, hypertension which is increased blood pressure, diabetes mellitus, middle age to the elderly people are more prone to DVT, that is seen in increasing age, obesity and in case of pregnancy. Pathology of DVT or deep vein thrombosis. We have something called as the Virchow's triad. The Virchow's triad comprises of these three things, that is stasis of blood flow. Stasis means blockage. So blockage or obstruction of the blood flow, endothelial injury and hypercoagulability. So you can remember it like this. Whenever there is a blood vessel injury, that is endothelial injury, there is stoppage of blood flow. Whenever there is stoppage of blood flow, it results in accumulation of blood, which is called as hypercoagulability. So let's see what happens. There is damage to tunica intima, which causes the platelets to deposit on the vein wall, resulting in venous stasis. This increases the accumulation of platelets and adds up to the size of the thrombus. This thrombus results in the occlusion of the lumen. Sometimes the portion may break off, that is, the thrombus might break off, giving rise to pulmonary embolus. Pulmonary means the lungs. So pulmonary embolus further can result in pulmonary infarction. Then we have the clinical features or the signs and symptoms of DVT. These are the most important features which you need to remember. First, lower leg swelling. Then edema around the joint distal to the area. What type of edema? Usually a pitting type of edema. That is, whenever you apply slight pressure using your fingers over the edematous area, you are going to see a slight pit or an indentation of the area. Thirdly, pain in the calf muscles or the thigh. Fourth, redness in the calf muscles. Pain in the calf or on the thigh region on palpation. Red and hot skin. Palpable cord-like structures along the involved veins. Now we have the criteria for DVT. Wells criteria is a tool which is used to screen for DVT. These are the two special tests or the clinical tests which are used in deep vein thrombosis. The first one is the Homans sign, which is also called as the dorsiflexion sign test. So the procedure involves the patient lies in a supine position and the patient actively extends the knee. Extending the knee is very important in this test. Now the examiner raises the leg to 10 degrees. Then passively and abruptly dorsiflexes the foot and squeezes the calf muscles with the other hand. If pain or tenderness is seen, the Homans sign is said to be positive. Next, we have the Moses sign, also called as the Bancroft sign. Here, the procedure involves patient lies in a prone position with the knee flexed. The therapist squeezes the lower calf, and if it elicits pain, the Moses sign is said to be positive. Complications of DVT. It results in pulmonary thromboembolism. Pulmonary means lungs. So the arteries in the lungs become blocked by a blood clot. The features which are seen in pulmonary thromboembolism are unexplained dyspnea, which means shortness of breath, pleuritic chest pain, hypoxia, tachypnea, and tachycardia. Tachycardia means increased heart rate, and tachypnea means increase in the respiratory rate. Medical management for DVT is the prescription of anticoagulant drugs like warfarin, that is low dose, heparin, and aspirin. Heparin is the drug of choice in deep vein thrombosis. Analgesics, which are pain relieving agents, antibiotics, and anti-inflammatory drugs. Investigations for DVT includes phlebography, Doppler's probe, and coagulation profile. Prophylactic measures for DVT is early ambulation, foot elevation, ankle toe pumping exercises which are given in physiotherapy like ankle dorsiflexion, plantar flexion, inversion, eversion, and elastocrep bandaging. Precautions for DVT. So previously under prophylactic measures, we said that early ambulation is important. So when to start this mobilization or ambulation? It depends upon the type of medical treatment which is given. So if the patient is on anticoagulation therapy, you need to mobilize the patient once the patient is in the therapeutic range. That is, the coagulation profile should be in the therapeutic range. Secondly, if the patient is on IVC filter, that is inferior vena cava filter, mobilize once the patient is hemodynamically stable. Another thing to remember is you need to screen for all the fall risk patients. That is when a patient is on anticoagulation therapy, because anyone on anticoagulation therapy is going to bleed easier, and if they fall or if they injure themselves, they will bleed more easily than someone who is not on anticoagulation therapy.